Alan, even if you've got travel insurance for that trip abroad, if you happen to get sick or injured, well, you could be waiting a long time to come home. The medical evacuation process, that's not necessarily the problem, but finding a bed at, say, Credit Valley Hospital or any Ontario hospital, that could be slow.
I would really like a bed for my father and care for my father.
From her father's hospital room in San Jose, Costa Rica, Emma Rice of Bowmanville has a plea to Ontario's healthcare system.
I don't speak Spanish. He doesn't speak Spanish.
69-year-old Grant Rice of Calabogie, north of Kingston, fell ill early this week in the country. He's now on a ventilator.
The time he was admitted, he was unable to really breathe very well or swallow.
He was about to return home when he got sick and was admitted to a hospital in San Jose. Getting home to Canada is a 5-hour flight by Medivac. The insurance company has a plane ready, but they can't fly while at a hospital to receive Rice.
So far, I've had no luck. They've had no luck. They did tell me, too, that this is always the biggest obstacle, that it's always a struggle. They're finding people are stranded because they can't get beds.
We've reported on this problem before. In 2017, Ali Davari was injured in Germany. The 84-year-old needed to come home, but for a long time, Toronto hospitals wouldn't accept him.
Just secure a bed for him to be able to come back.
The family practically begged for one.
Just help to bring him back. Just secure one bed.
Davari eventually came back to Ontario, where he died a short time later. Even if you have insurance coverage for your trip, it's not a guarantee you can get home to a hospital bed quickly. Ontario's Ministry of Health told Global News Ontario always has available critical care beds to care for those most critically injured. But the waiting game for one, the search for a place for Grant Rice, continues.
It's terrifying, and especially because it's not a barrier of insurance. It's not a barrier of care on this end or anything like that. It's simply that our country, where we have healthcare that we pay for with our taxes, is unwilling or unable to take him.
Now, Criticall Ontario is a 24/7 emergency referral service paid for by taxpayers. Their job is to get people repatriated back to Ontario. Now, ministry spokesperson told me earlier today they would always facilitate care and they would never tell a patient or an insurance company no. But the question in this case is, when are they going to say yes so that this man can be able to come back home? Alan?
Thank you, Sean.